All right, and we are live. Thank you everyone for joining us tonight. My name is Hannah Leitner, and I'm a marketing strategist at UT Health East Texas. We are excited to host this panel about concussions and look forward to sharing a little bit about what to look for and when you should seek additional care. Tonight, I have three concussion experts with me. I'll start with our two board-certified primary care and sports medicine physicians. Just give a little wave. Dr. Robert Galbraith is right there, and then Dr. Rebecca Peebles is right there. I believe they both practice on Patriot Drive in Tyler, correct?
That's correct.
Perfect.
Correct.
And then last but not least, we have Dr. Andrew Schmidt, who's a neuropsychologist at UT Health North Campus in Tyler. Thank you all so much for being here tonight.
It's great to be here. This is exciting.
Yeah, we're excited to hear what you're saying and just learn a little bit about concussions. So I'm going to jump into the questions shortly. But for those watching, feel free to comment any additional questions below. I'll be monitoring the page as we go, and hopefully we'll be able to answer your questions live. But if we don't get to them, please still ask your question in the comments. Our social media team will be sure to get those answered for you. Let's get started with the meat of this presentation, if you will. We'll start with an easy question first, which is, what is a concussion?
Well, that is pretty easy. You're kind of throwing us a softball just to begin with. Well, thanks so much, Hannah. I appreciate it. I think we're all really excited to be part of this Facebook Live, and especially this time of year as school is just about to get underway with kids. Fall football practice or the end of the summer practice is just getting underway. And we're starting to see kids already get injured in the office. And I think this is really pertinent. I had spent the last 11 years up in Canada, and so saw lots of concussions, both in football and hockey. And maybe the other two can comment a little bit about their experience with concussions before we answer that question too.
So I am new to the practice as well. I just moved from Nebraska. I spent the last 8 years in the military, so I was in the Air Force, and treated a variety of sports concussions, covering football and other sports throughout my career, but also just treating concussions related to military service and things that everyone was doing on or off duty.
My experience with concussions is sort of on the latter end after the acute stages. In the cases where there's some persistence of symptoms, I'll conduct a full neuropsych assessment at that point. So I'm seeing the person further down the line if there's still the perception that there are some deficits involved. The neuropsychologist will get involved at that point.
And I think going back to your question, Hannah, originally, what is a concussion? So we know a concussion is a type of brain injury. And there's a whole host of different kinds of brain injuries. Some are more mild and some are quite severe and debilitating. Concussion is considered a mild traumatic brain injury where there was some type of trauma to the brain or to the skull that caused a brain injury. And then that resulted in a number of different symptoms. And they're usually a combination of certain physical symptoms, certain emotional symptoms, certain cognitive symptoms. And it's really a complex kind of pathophysiological process. But gratefully, it's usually not serious in most people, usually runs its course. And there's a few key things I think will be helpful to identify a concussion and then help us with appropriate management to help these student athletes get back to play.
Okay.
See, I can already tell Hannah doesn't like my answer.
No, your answer was just fine.
No, and I don't know if the other two,
me?
Dr. Peebles, Dr. Schmidt, is anything else that you wanted to add to that?
No, I think that's it.
It's generally considered that mildest form of traumatic brain injury, TBI. You might hear that term, like Dr. Galbraith said. Think of it as a bruising of the brain. There's a little bruising of the tissue, and it causes usually, and we'll get more into that later, but some symptoms that we'll probably get into a little bit later. Acute.
And so I know Hannah has a number of different really tough questions for us. And then
Yeah.
so we can hopefully answer some of these unique questions and then obviously field a bunch of questions from the viewers too. What difficult questions do you have for us, Hannah?
Sorry, you were cutting out.
Oh, sorry about that. Do you have any tough questions you want to grill us on about concussions?
Yeah, I do have a couple more questions. Hopefully the connection clears up. But what's the typical process you go or use for diagnosing a concussion? Will you need blood tests, MRI, a CT scan? Kind of what's that standard?
Yeah, I'll take that one. So concussion is what we call a clinical diagnosis. So that means that at the time of the injury or when we're seeing the athlete in clinic, we evaluate their symptoms, looking for anything that is common to concussion. Now, concussions can be a whole variety of what we call non-specific symptoms. Lots of different things can happen. Headache, trouble sleeping, anxiety, all sorts of stuff. And then we do a physical exam and we look for different signs, again, that are common with concussion, and then we make that diagnosis. There is a lot of research being done in terms of looking for biomarkers, testing saliva, you'll hear about cheek swabs, testing blood, looking for different factors in the blood that can diagnose a concussion or give information on how long the concussion is going to last. None of those right now have enough evidence to actually use in clinical practice. Now, if you do a lot of reading on the internet, because I know most of you guys are looking to the internet for information, especially in these COVID era days, you will see that there's FDA approved tests for some of this. It's not to diagnose concussion though. The one test that's been approved in Europe is actually looking at diagnosing or favoring brain bleeds and other actual like intracranial or in the head injuries, but it doesn't diagnose concussion. So be careful as you read, if you read about those things. Now, as far as head imaging, so Hannah also asked about CTs or MRI. We will sometimes order a CT scan if we're concerned about either a skull fracture or a brain bleed or one of those more serious things. So as we're evaluating, we look for what we call like red flag symptoms, things that just give us an idea that there's a more serious injury. And then we'll get a CT scan. Brain MRIs, we don't order very often. And a lot of times if we're ordering a brain MRI, we're thinking about getting Dr. Schmidt involved because those are going to be our atypical concussion presentations. And then if we have a concussion with prolonged symptoms or lasting longer than we expect, so that's going to be for adults and our older teens, more or less anything that goes past 2 weeks or beyond. But a lot of times we can work through those symptoms a little bit longer before we're thinking about ordering that higher imaging and sending them for neuropsych testing. Or for our kids, and this is a really important thing for the parents to realize, any of our younger kids, concussions are expected to last for upwards of 4 weeks, and that is considered normal. The symptoms should be gradually improving through that period of time, but 4 weeks is pretty standard for a concussion in our kids, and it just has to do with the way that their brains are developing. So if there's any concern there, that's when we're looking to order MRI, but again, not to diagnose the concussion.
Okay.
That'll be the
Awesome.
day. Won't that be exciting when we could have just a simple lab test? That would be awesome.
It'll be great. We can just swab a cheek on the sideline and give a thumbs up or a thumbs down instead of pulling athletes out, but maybe someday, but not right now.
Yeah.
Okay. Does anyone else want to chime in on that? Or should I move on?
Go ahead.
All right. So how long does a standard concussion last? Is there any way to tell or judge?
So Dr. Peebles started talking about some of the pediatric population when we're dealing with kids, because we'll see young kids with concussions too. I mean, you see kids that are young, elementary, junior high school, playing especially contact sports like football. But then we can see them with other injuries like skiing and snowboarding, skateboarding, rollerblading, biking, etc. We find compared to adults, let's say adults, the average adult, about 80% of us will recover within about 7 to 10 days, occasionally up to 2 weeks. So 7 to 10 days is pretty standard. That's why kind of back in the day, if you used to go see your family doc or a physician for a concussion, most of them said, well, I don't know, just take a break from sports for about a week and then go back in and you'll be good to go. And that was probably appropriate for 75 or 80% of the population. But then about 20% of the adults will have symptoms prolonged past that 2-week period. As Dr. Peebles alluded to, I agree. You see those kids, and again, it's usually those maybe under 10 or just in the early preteen years. They're going to take 2 weeks, 3 weeks, sometimes even up to 4 weeks, probably because these kids are still maturing and have a developing brain. Dr. Schmidt, good to have you back.
Yeah,
Yeah.
I apologize, everyone. It looks like I cut out and froze there for a second, so I backed out. I might have missed a comment, but what I heard is basically right. You're looking at various different presentations, and most of it will usually you'll get full recovery for most people in a short period of time. There are those intransigent cases that we want to get further testing on later on, and we have those abilities to do that. Did you say 20%, Dr.?
Yeah, in that ballpark of 20% of
Yeah.
adults will have persistent beyond 2 weeks.
Beyond 2 weeks, yeah. And it's even less rare to go, or more rare to go beyond, say, 2 months, where symptoms persist beyond that. Yeah, that's what I've seen.
Right, thank you so much. So moving on to the next question, when can a student athlete or when can an athlete return to sports after a concussion?
I mean, that is the million-dollar question that everybody wants to know, right? So if I had a crystal ball, I would be famous and rich because that would be a great way to predict it. Unfortunately, every concussion is a different story. So we look at each individual athlete that has a concussion and we just walk them through their symptoms. The biggest thing for returning to sport is being back at what we call your baseline or symptom free. Now, that doesn't mean you can't do anything while you have the concussion, and we'll get into that, I think, in a little bit with some of the other questions. But having complete resolution of your symptoms, really big deal. You can't jump straight back into sport, though. There's something called a graduated return to play that either your physician or if you're at a high school, you should have access to an athletic trainer. They can help walk you through. There's some really good guidelines on the CDC website, Center for Disease Control. There's a lot of good resources out there that you can look to get an idea of what that is. Primarily, your physicians can help you with that. I would say the majority of physicians have some training in concussion. Not everybody's as comfortable as some of the sports docs or neuropsychologists that see them more frequently. So if there's ever questions, we're a great resource. I know some of the other facilities in the area have concussion programs within their sports medicine departments, but it's important to find someone that's comfortable guiding that return to play process to make sure that you get back to sport safely. Each day or each phase, in that return to play is going to be at least 24 hours. So if you're symptom free that first day, you rest and then you can start going through that progression and it'll walk you through at about the 1 week mark. And then you can return to sport. If you develop symptoms anywhere within that progression, then you go back to the phase before. If you're having trouble progressing, you need to see your doctor again. So those are kind of the big keys to getting back, but getting back safely.
You know, maybe I'm in here too, Dr. Peebles. I think that graded return to play is huge. And basically, as sports medicine physicians, we follow pretty much a standardized graded return to play that's used in the NFL, that's used in the NBA, that's used in professional international rugby, every professional sporting organization. And maybe do you want to comment on what some of those certain steps are as we kind of start from ground zero and then clear them to full participation? That way I can put you on the
Yeah,
spot.
definitely. Sure, anytime. Yeah, so it's going to start with just basic aerobic exercise. So you're not doing anything intense, you're not doing anything that's really going to get your heart rate up, but you're moving. And then as long as there are no symptoms with that or worsening of symptoms with that, you should not start that until you have symptoms. If you develop or have recurrence of symptoms, you need to go back to whatever the phase was before. So once you can do basic activities of daily living, once you can do some walking around the neighborhood, the next phase is going to be getting your heart rate up. And then you're eventually going to progress into doing sport specific drills. So if you're a football player, that could be doing some karaoke's on the sideline, running some plays. Again, it's all non-contact at this point. You don't want to get hit again because you don't want to put yourself at risk for getting another concussion. And then you'll progress until that last phase is when you can start doing the contact drills again, and then eventually get back into playing once you progress through the return to play protocol.
Sorry,
Can I just add one thing?
You can dish it right back.
There you go.
Go ahead, Doctor.
Having the sports medicine physician involved in this process is really the key at the acute phases, because the player wants to get back. So very often the player is pushing to get back on the field. The coach sometimes is eager to get their star player back. The sports medicine physician is not going to put the player at any kind of risk for further injury. So following those early protocols in the first hour, the first 4 hours, the first 24 hours, that's where, if you can get to a sports medicine physician, that's the early key. That's when all the important elements are put in play. And the advice to that player goes straight from the physician to the player, letting him or her know how important that is at the early stages. Because the brain's very resilient. The brain will heal, but they're the experts in knowing how long that's going to take and what procedures to allow the brain to have its full healing potential.
Yeah, and something I've seen, so I kept putting emphasis on you need to be completely symptom free, you need to be back at baseline. Something that I've seen that's prolonged athletes from getting back into the game is persistent symptoms like headache, anxiety, some of these things that actually can be related to other conditions that either weren't that bad before the concussion or maybe were not diagnosed before the concussion. So if you're finding that it's feeling like a really long time before you can even start this return to play protocol because you have some lingering symptoms, that's a great time to get us involved also, because we can look at the symptoms, we can look at how everything has progressed and try to tease out whether or not this is a different condition or whether or not this is truly symptoms from the concussion, and then manage those symptoms appropriately. Sometimes it's getting other specialists involved, like physical therapy or working on headache management, and then we can get you into that return to play protocol safely, but maybe even a little bit quicker depending on what's going on.
I think you both make some good points. That made me think too, as we're trying to communicate both with players and parents, I work with different schools. And as we have that relationship with different schools, most of these schools have athletic trainers on site. So today, for example, I saw an injured athlete, not a concussion, but I was able to report back with the player's permission, report back to the athletic trainer and said, hey, here's the update on their injury. Here's my recommendations moving forward. And that way there's that clear communication between healthcare provider and then also the trainer to help really expedite that return to play appropriately. Because sometimes I've found teenagers may not be the most reliable historians. Occasionally.
Sometimes intentionally, sometimes unintentionally, but I have seen the same thing in my practice. And yeah, it's the exact same with me. I talk to trainers at least twice today that I can think of offhand in the middle of my clinic, just helping with that warm handoff and coordinating care.
Okay, thank you all so much for that answer. We're kind of shifting gears now to prevention of a concussion, but there's a lot of marketing for concussion helmets or concussion mouth guards. Can these items prevent a concussion?
Yeah, maybe I'll take that one. Boy, it is a really hot topic right now in the media and has been for a number of years. You'll see all these different helmets marketed online. You'll see commercials. You go into the sporting goods stores and they'll advertise this kind of the new premier concussion helmet. Do they really prevent concussion? To be honest with you, the best research we have right now doesn't necessarily show that they do, despite kind of all the marketing hype. I will say it's a pretty cool area of research. And I think it's really intriguing and exciting. And I look forward to a lot of new advances there. But you'll see with what can some of these concussion helmets look like, actually are larger. Some have added protection, added pad around them. Some are made out of different materials. They can be made out of different shapes. Both in football, and you'll even see in other sports where they can put an added cover on top of the helmet. Rugby has like a rugby scrum cap. Soccer can sometimes have these different head guards. And again, they're often promoted for concussion prevention, but we don't have any solid research that they really help prevent concussion. Now, can they help prevent injury? Well, yeah, we know like in rugby and soccer and even just a good football helmet, they can prevent against lacerations. Sometimes you can get a big hematoma. They even prevent against fractures of the skull, certain bleeds in the brain. So there's still a huge benefit for using a helmet, even though it may not necessarily prevent concussion. Probably one of the most important things with concussion is to have an appropriately fitted helmet, one that can fit nice and comfortable and snug, regardless of what the hairstyle of the week is, or if they're wearing like a do-rag. And mouth guards, kind of similar to concussions. Mouth guards, many are marketed again for concussion prevention, but don't really seem to hold up in research. But mouth guards do help protect teeth. So I think I would still recommend using a mouth guard. Prevention, there's a lot of other things I think we can focus on maybe a little bit later if someone has questions about prevention. But for concussion, helmets and mouth guards, I guess that's maybe my 2 cents.
So piggybacking off of that, I have 2 comments. One, when I started playing rugby and I called my parents and told them, my mom's response was, "Hey, I paid way too much for your smile. You better wear a mouth guard." And I was like, well, at least she understands that it's not going to prevent concussions. So yes, they can they can help protect teeth. But no, in all
Your teeth look
seriousness,
great.
so thank you. Yeah, I wore my mouth guard despite most rugby players not wearing them. But one thing that we do see both on the field but also in the literature is, not all the time, but with some athletes, if you're wearing these protective, like extra layers of padding or something, sometimes that can lead to more aggressive play behavior because the athletes feel like they're more protected. When in reality, there's not actually any decreased risk of concussion. So be careful if you're looking at those extra devices.
If I could just add one additional comment to that, that these devices are probably great that we're researching that and all, but understand that the concussion occurs when you're moving forward at 17 or 18 miles an hour through space and you stop immediately. That's what a lot of contact sports are about. The brain's going to move forward in its cavity, regardless of what kind of devices you have protecting that. And it's when the brain makes contact with the skull that there's going to be some concussive forces there. Not only that, and some rotational forces too. So it's really hard to prevent that when you're moving forward and part of the sport. It looks like you may have played hockey there, Dr. Galbraith. I see the hockey stick there.
Well,
you're
tried.
using. There you go. With me, it's football, but there's going to be contact, and as soon as that body stops, the head stops. There's going to be some impact there, and the idea is to try to minimize that and treat it as soon as you can.
I think that's a good point too about the brain moving in the skull. Regardless, you can be hit in the chest and still have a whiplash injury, and the brain can still shake in the skull, leading to a concussion. And thinking back to research, they have a bunch of sensors. There's a lot of cool research about sensors in helmets. Now, sensors can measure some of that linear acceleration and also some torsional forces as well. But it's interesting that they found that the level of force to cause a concussion is so variable. And so there's not like one threshold that causes every concussion. So it's kind of interesting to measure that, although we're still trying to figure out how can we best apply that clinically.
Yeah, and looking at the data from those, we don't really have a good answer either. I get asked a lot when I'm talking on concussions of, if you have more and more impacts at this what we call submaximal threshold, so not causing a concussion, do those eventually amount to a concussion, or do those increase your risk for concussion? And we just really haven't seen any data to prove that in the literature.
You're stirring the pot.
Man, there's just so many cool things going on in research right now with this, but we just don't have a lot of great answers at this time.
It's good. These are the questions that we want you to answer and discuss with each other. It helps us get a better understanding for them. So the next question that I have for you is, if you get one concussion, how likely are you to get another concussion? Does this increase your risk of experiencing another concussion?
I'll maybe jump in on this one too. Like Dr. Peeble said, that's a tough question to answer. I'll start with the simple answer of probably, but there's so many factors involved in that. It kind of depends on what was the mechanism of concussion, when are the repeat concussions. For example, if someone has concussion in September, does that put them at an increased risk of a concussion 2 weeks later? Well, what about 2 months later or 2 years later? I would say more and more research is showing that if you have a concussion shortly after that event, we know that threshold to get a concussion is lowered. And we think more shortly thereafter, and it takes probably less force to get a second concussion, less trauma to get a subsequent concussion, especially if it's close to that original injury. If someone's having back-to-back head injuries within a short period, recovery often takes longer. Maybe initially it took them 1 week to get better, and then it took them 2 weeks, and then that third concussion, within a short period, it took them 2 months to get better. Those are red flags to me. But I think one of the big questions is, if you have one concussion, what about having one 6 months later? Does that tee you up to have an increased risk of having another concussion? I'm not sure. There's just a lot of factors and variables in that. Do any of you want to comment or chime in there?
I see the same thing with
I
my
think that
athletes.
covers it
There's
for
not
me.
a really great, yeah, there's not a great
Mhm.
predictor as far as like having had a prior concussion. The big red flag, I'm just going to put an emphasis on this, is if you start seeing concussions with less amount of force, or concussions that are taking longer and longer to get over the symptoms. That's kind of a red flag to me that, yeah, there may be a lower threshold for getting another concussion.
And it's so
Okay, good
individualized to
points.
patient. It's so individualized to
Yeah.
patient that's why it's important to have that physician follow your particular course. If the physician just used a standard protocol, the same for every patient, you really wouldn't be giving that person that individual attention. That's what the sports physician could do, is individualize that treatment plan for that particular patient.
Yeah, I agree 100%.
Okay, thank you so much for that answer. Now we're kind of shifting back to prevention. Again, we talked about helmets, we talked about gear you could wear to possibly help minimize damage. But what about any type of supplements for concussions? Has anything been proven to help with the treatment of concussions or the prevention?
I'll take that one. That's a great question. And again, this is another really interesting area of research that is very active right now. There's tons of studies out there. There are some studies that have been done. Unfortunately, for this level of research, the studies that have been done are either on animal subjects, and that's hard to compare to humans because inducing a concussion on an animal doesn't take into factor all the things that go into a human concussion. Like Dr. Galbraith was just saying, concussions for each individual athlete are so multifactorial. There's so many things that play into the individual injury, how they respond, how their symptoms progress, all of that. So applying those, we have to do with caution. There are some human studies coming out. Most of them are really small though. So when we're talking about good scientific studies, we want to see large studies with a lot of numbers. And then the studies that we do have that are a little bit bigger and a little bit more well done are mostly done in the severe TBI, so the severe traumatic brain injury category. So the application for concussion on those, we don't really know how applicable that is. So I think there's a lot of promising stuff out there that I think down the road we'll have better ideas of whether or not this is something that we can actually recommend. Now, I will just throw one layer of caution on here. Supplements, you have to be really careful with. They are not regulated by the FDA. So we don't know what's in them. we don't know if what's on the label is actually what's in them. Some studies have shown that what is on the label for a lot of these things that you can buy at Walmart, GNC, whatever pharmacy, Amazon, for most of us that don't actually go to the store anymore, what we think we're taking is not at all what's in the product. So you have to be really careful with these and consider, is there any risk of overdosing on some of these? A lot of them are safe, but some of our vitamins can be dangerous if you get too much in your system, but also contamination. So if we're looking at our NCAA athletes, so our collegiate athletes, or even I know we have some professional athletes in the local Tyler and East Texas area, those organizations are heavily regulated in terms of what they can take, what their athletes can take. So you have to be really careful and know what you're actually putting into your body. I think one of the big take home points for this is not doing anything major. So if you look at the supplements that are sometimes recommended, it's going to be things like omega-3 fatty acids, vitamin C, vitamin E, vitamin D is a big one, magnesium. Now, these are all things that are found in a really good, well-rounded diet. So as you're addressing your symptoms, or as you're kind of at home trying to figure out how to recover quickly, some of the keys are staying really well hydrated, eating fruits, vegetables, your lean meats, fish. You'll get some of those omega-3 fatty acids, and not necessarily taking a bunch of pills to try to get back onto the pitch or onto the field faster is going to be one of the best things. I've seen some preliminary data on ketogenic diets too. I think there's a lot of hype about ketogenic diets in general. Again, eating a well-rounded, balanced diet is going to be key for this. So one thing just to keep in mind with the ketogenic diets, that there's a lot of controversy on this. One of the big things that your body is struggling with the concussion is decreased energy. Your brain is using a lot of sugar, a lot of glucose to try to deal with the process that's going on at like the molecular level in your brain. You're going to feel more fatigued. You need that sugar. You get sugar from carbohydrates, from fruits, from all the things that you may not be getting in a ketogenic diet. So while there may be some preliminary benefit, there's also great risk in that too. So again, just not overdoing anything, everything in moderation, and trying to get a really good, well-balanced diet with good hydration is going to be probably the best thing that we can recommend at this time.
Can I maybe make one added comment too? You know, and I think
Sure.
Dr. Peebles talked about some great diet and lifestyle, I was going to say modifications, but behaviors that we should really encourage, probably in all people, especially those people recovering from a head injury. Just to add on to what she had said, most sports medicine specialists will also encourage abstaining from tobacco, alcohol, often energy drinks and caffeine during this period to really maximize recovery. And encouraging great sleep, that's really important for brain recovery, in addition to this healthy diet. You know, maybe I have a question, just a side note, Dr. Schmidt. You know the literature better regarding some of the chronic, persistent and severe traumatic brain injuries. Are you able to comment on any supplements? Maybe that, are there any supplements that show benefit for some of those types of injuries?
You know, I think we have to be really cautious about supplements because you see so much on the internet. But when you look at carefully controlled studies over time, very few of them actually bear out to be beneficial, especially with concussion. What you just said, Dr. G, was the issue of sleep. What sleep is the restorative phase of the brain. It's when it clears out free radicals, clears out debris. That time period, especially when we're talking about REM sleep and stage 3, stage 4 sleep, that's when the brain is doing its healing processing, when the body is doing its healing processes. So I think you might wonder why Dr. Galbraith said, well, why caffeine? Well, caffeine's a stimulant. We want to get as restorative sleep as we can. So for long-term TBI, the things that your physician tells you about general health are the things that preserve long-term brain health. Good sleep, we mentioned. Abstaining pretty much completely from tobacco. We all know now that's pretty unhealthy. One thing I always mention is that brain health is really a factor of blood health. You know, so if we can keep our cardiovascular system healthy, we keep fats low, we keep good nutrients, we eat a very well-balanced diet. Some physicians will recommend a supplement or a multivitamin, but beyond that, I don't think we have solid evidence for significant supplements to enhance long-term brain health as well.
I have one more comment.
Okay.
So, Dr. G, you brought up sleep, and I can't emphasize enough how important that is for recovery from concussion. One thing just to bear in mind is that sometimes the sleep issues after a concussion can just be from all the changes in the brain and your brain trying to heal those. But one thing that we frequently see is some of those sleep issues are actually resulting from anxiety and some other conditions that are either symptoms of the concussion or symptoms conditions exacerbated by the concussion. So if you're really struggling with sleep, especially after the first couple of days of concussion, that is one of the big reasons why you should probably get one of your sports docs or someone who's really comfortable in concussion management involved to try to tease that out and help you get better rest.
Yeah, can I piggyback on that, Doc? Is a lot of times the brain has gone through the healing process after 1 or 2 weeks, and the anxiety that Dr. Peoples is talking about, that can impact our general function. When we're actually trying to do concentration tasks and we're struggling with that, it may not be due to brain injury. It may be due to some of those sleep factors, health factors, psychological factors that we want to look at too. We usually make the attribution to the brain injury because that's the thing that we just sustained. Well, it must be the brain, the concussion I just sustained must be impairing my function. But there are other things that impact that. And the anxiety about having a mild TBI can also impact that.
Hannah, I hope we were able to
Okay.
answer your question.
Yes, it was a
She's
great
done
answer,
with
and
us.
you got ahead of me. My next question was, other than rest, do you recommend any other treatments for concussion? So I'm going to ask it if you have anything else you want to add. Now's the time.
I want to just define rest for a minute. So we've been talking so much about sleep, and sleep is super important. Now, going back many years, we used to have this term like cocooning or just complete total rest. And that was the big thing. That was treatment for concussion. You needed to hole yourself up in a dark room and stay there for several days to maybe even a week. Now, while total brain rest and physical rest is really important in the acute phase, meaning right after the concussion, we now realize that that period needs to be short. So 24 to 48 hours at the most of total rest. And we're talking not playing on your phones. So brain rest also is devices of all sorts, but really not that long. So first day or two. Beyond that, getting moving, but doing it at a level that isn't going to increase your symptoms. So again, we kind of mentioned this earlier with the return to play protocol, but one of the first things you can do is just start doing things around the house, things that won't get your heart rate up. Maybe go out for a light walk and start incorporating that light cardiovascular exercise or aerobic exercise. So one of the best things you can do that's going to increase blood flow to the brain, which we know is decreased after concussion, that'll help repair some of the things that are going on in the brain. It will help improve sleep. It's going to help decrease anxiety and depression and some of those mental health issues that we've been talking about that can be associated with concussion. Lots of really great benefits. And again, you want to be gentle with it. You don't want to do too much. If you're starting to have headache or any of your symptoms flaring, you're doing too much and you need to go back to either lighter walking or just take it easy for the rest of the day. Some of the other things that are just important to note here is getting slowly back into school. So we talked about getting back into sports. For our student athletes, their main goal, while we want them to remain active because we know that there are lots of great mental health, physical benefits of being active, we want to get them back to their sports. Actually getting them back to the classroom is going to be one of our top priorities for them. Sorry to say it. We want to get you back to that first so you're not falling behind in your classes because that is a huge priority. So again, like we've talked about with sports, getting back to doing homework assignments. It may mean reading for a few minutes and then taking a break when you start to get a headache, but slowly incorporating these things back into their daily routine. A lot of schools will have either the guidance counselor or some other person on campus that can help with some of the class modifications, if those are even necessary. For a lot of our student athletes, that won't even be necessary after the first day or two. But we do occasionally see where concentration is really difficult. Sometimes focusing on a computer screen because of the brightness of the screen can be difficult for those couple of days to maybe a week or two after concussion. And so there may be some classroom modifications needed. We talked about supplements, which we don't across the board generally recommend. But those are some other keys that can really help speed up concussion recovery.
Can I make one comment too? This is maybe just to reiterate one thing Dr. Peebles said a few minutes ago. Many of these injuries, so the most common symptom that people have with concussion is headache. And usually the second or third most common symptoms is neck pain. And sometimes neck pain can actually trigger headache, or it can exacerbate a headache. And sometimes it can be difficult if you have a concussed athlete that's not progressing as well, they're having persistent headache. How much is it from their concussion versus how much is maybe being referred from their neck? And so we're big proponents of doing some manual therapy of the neck. And it's usually gentle manual therapy you can get like from a physical therapist, a massage therapist, chiropractor. You can have osteopathic manual therapy to gently address some of that muscle tightness and spasm in the neck to help not only neck pain, but also headaches as well.
Yeah, getting a concussion specialist or a sports medicine doctor on board early can also help identify some things that may need specialty care for. So if you have ever heard of like a vestibular concussion, some athletes will have a lot of trouble with either balancing or those quick, like if I turn my head, I get really dizzy, and that can be really disturbing for them. So some of those specific symptoms may need to be addressed. Sometimes they go away with time, but sometimes we need to address them with a specialized type of physical therapy that addresses that vestibular system and can help increase the speed of getting rid of those symptoms. So if there's any question, find someone that can help kind of teach out with this appropriate help.
Dr. Peebles, can I ask you a question?
Yeah, absolutely.
Yeah. So regarding treatment, do we take the cell phone away from the teen in the acute phases of the concussion? And if so, how?
I don't have teenagers at home. Dr. G does, so he may be a better one to ask about this because I think a lot of teenagers are going to get really mad about that. It depends on the athlete, I think is the best answer to that. I think some kids will be fairly compliant and they'll stay off their devices, and some kids may need a little external encouragement by not having access to their devices. So that's a hard question. It depends on the student athlete, but we do see if there's a lot of texting, if there's a lot of playing on phones and other devices, that can sometimes prolong symptoms or worsen those initial symptoms. And it can be a really big deal. It can be really disturbing for the athlete, and they don't realize that they're actually doing it to themselves by not following the guidance of, hey, put your phone down for the first day or two. It's not that long, it's just a day or two. But it can seem like a lifetime for teenagers. I totally get it.
Yeah, I have
Can I
teenagers,
share one brief
and
story?
it seems like that would be a challenge.
Definitely.
I know we all could share like a million stories about concussions and managing difficult patients. I'll just share one brief one that made me, your question made me think of that. I saw this one high school junior player. She was a rugby player, had a pretty significant concussion, had a lot of symptoms, and it took her about 2 or 3 weeks to finally get back that slow, gradual return to play program. And then she went back to practice. She was doing great for a couple of days, and all of a sudden she significantly regressed. And she came back to the office with her mom this time, and we were really struggling to figure out what was it that tipped her over the edge. And come to find out, it wasn't the actual physical exertion. Over the weekend, she had gone to like 6 Star Wars movies, and then she literally spent about 6 hours the following day texting on her phone. And when her mom found that out, she had some choice words with her daughter, but we kind of had to come to Jesus talk. But it was really helpful having a parent in the room. So mom could help, and I don't want to say maybe police the phone, but help kind of give some restrictions and guidelines home with some supervision. And she returned great after that.
And this is actually a perfect segue to our last question of the evening. But if concussion symptoms persist for many weeks or even months, what other tests or treatments are available?
Yes, I'll take this one because this is the phase that I usually get to see people. Often it's car accident injuries and other things that I do, but with concussion as well, that can persist beyond the acute phase. So what the neuropsychologist does is we have standardized tests that have been around 5, 10, 20, 40 years in some cases. So we put together a standardized battery. You wouldn't want to do this in the acute phase of a concussion. You're doing some minimal testing. You don't want to put someone this, but after 3 or 4 months after injury, if that's still persisting, it's a standardized battery of about 4 or 5 hours of testing. It could be that long. It could be somewhat briefer. These are tests that are normed to that person's age and education, premorbid ability, all those parameters that we look at. And we're looking at different cognitive domains. We're looking at memory, of course, is the thing that patients come in with, but we look at global ability. We look at attention and concentration, which when people have memory problems, often it's really attention and concentration that they're really struggling with. They perceive it as memory. Visual spatial functions, language. We look at all the different domains, and we also test general psychological status, because a lot of times we're not really looking at brain injury. If it was a mild TBI, it's often the perception and the anxiety and the depression associated with that. It may not be functional cognitive damage. We may be looking at psychological factors. Sometimes we don't want to hear that, well, I had this brain injury, that's why I'm struggling. You had a concussion, it usually heals well, but sometimes those psychological and social factors can impact that. So we look at a broad range of abilities, and we work with the physicians with this. We work with the sports medicine physician. We'll work with the neuroradiologist who's looking at MRIs. We'll look at general health condition. We analyze all those factors in with the test scores to come up with a conclusion as to what we're looking at. And sometimes they will persist, and we'll see mild deficits, usually in attention and concentration, maybe processing speed, usually not long-term injury to memory, usually not long-term injury to global abilities. But that's what we're trying to do, isolate that, and then work towards serial testing so that we can see that improvement. Rarely in mild TBI will things persist beyond 6 months. I don't have an exact figure because it depends on what kind of injury, but it's pretty rare beyond 6 months where a mild TBI, even moderate TBIs where there's loss of consciousness, post-traumatic amnesia, you're going to see significant improvement in those first 6 months. So anyway, I could go a little bit long with TBI, but we'll just stop there. And I think we have some questions from the gallery, right? Do we have some questions, Hannah?
Do we have questions from
the people watching, or?
I think there's been lots of positive feedback. They've really enjoyed watching, but no new questions from the audience.
Okay.
They're easy
So
today.
I think, yeah, they're easy to please tonight. So, anyways, I think we can wrap it up there. To our panelists, just thank you so much for taking the time to talk with us tonight about concussions. And then to our viewers, thank you for tuning in. If you do end up having a question, still comment it below, and we'll talk to our doctors and get the answer that you need. Also, if you did find this information helpful and you want to learn more about our sports medicine program, you can find more information at uthealtheasttexas.com/services/sportsmed. I think that's it for us. Thank you so much.
Thanks. Have a
Thank
great
you
night.
all.
Thank you.
Bye.